Today's video is about something that's really personal to me, is how to allow your transplant to last as long as possible and what you can do about it. Reason is because I've been living with someone else's kidney, a kidney transplant, for 18 years, and it never really functioned well. When I got it, it was called delayed graft function. It only got to as good as a late stage 3 kidney disease, and they told me I'd be lucky to have the transplant for 7 years. I didn't accept that. This became my lifelong journey, passion, mission. And here I am 18 years later with that same transplant, functioning better than it was before. And I'm still going to have it for quite a while, as long as possible, but we'll see. Only time will tell. So we're going to talk about a couple things that you can do to help your kidney transplant last longer. So here's the first piece of research from the Kidney Research Clinical Practice Journal, January 2022. The effect of periodontitis on recipient outcomes after kidney transplantation. So if you have bad oral health, it is not going to allow your kidney transplant to function as well and last as long as it should. Okay, that's just basic and simple. This has nothing to do with supplements or diet. It's just about keeping good oral health. So ideally, you should brush your teeth 3 times a day. Okay, brush 3 times a day. You should floss once daily, and you can also use an antiseptic mouthwash, and that really covers your complete oral health very well. Brushing 3 times a day may be difficult for a lot of people, often missed, but at least twice a day, morning and night, and do a really good job of brushing to make sure you're cleaning your teeth well, you're getting all of your teeth. And also see the dentist. The dentist is really important to do your cleanings every 6 months, year checkups. Make sure your oral health is good, because without it, your kidney's just not going to be functioning as well and last as long. So that's something simple. Okay, you don't have to change anything in your diet or take any more pills, just good oral health. So that's one thing to do. Make sure to see our other videos about kidney transplants. Okay, second thing is from the Transplant Immunology Journal, March 2022. Effective allopurinol drug use on GFR and proteinuria in patients with renal transplants. So what this drug does is lowers uric acid. High uric acid could be a complication of kidney disease and also kidney transplants. And a lot of times you'll know if your uric acid is high is if you have a gout attack, which can generally happen in your big toe. It can also happen other places in your body, but you'll know that. You'll see your doctor and they'll see that and they'll give you a medication to lower it. A lot of times though, you don't feel gout attacks and you could have a high uric acid level. So you should always know what your uric acid level is. You can get it tested by your doctor to see what it is. And what they did in this study was that they took people that had uric acid levels at 7 and they were having some symptoms. So they were having some gout flare-ups and they looked to lower them to a 6. And they found in 6 months that allopurinol, this drug, not just lowered the uric acid, but also helped maintain and support their kidney function over not doing anything, which was shown, because the placebo group didn't do anything. So this is something you can always talk to your doctor about. Even if you don't have symptoms and your uric acid level is over 7, it is a strategy that some people use to help keep it low and help preserve their renal function as best as you can. Now, I don't have symptoms, but I have a high uric acid that runs in the 9s, and I take a medication to lower it. I take it like 4 days a week, which keeps it under 7. I don't use allopurinol, I use another one, but you can bet the next time I meet with my nephrologist or my transplant nephrologist, I'm going to be bringing up this study, and maybe it's an idea for me to switch. I'm going to get their input. They're the experts on drugs. So that's something you can check to do. Those 2 things, good oral health, and make sure to get your uric acid level tested. Make sure you request and look for it on your blood work. A lot of people say, well, my doctor checks everything. And I can tell you a large percentage of doctors are not checking uric acid levels. So make sure to get it checked. Thanks for watching, everybody, and I hope your transplant lasts as long as possible and you have a good quality of life.